amazing response from our clients for that. Potentially, it has probably saved them some lives because the flu season is quite bad this year. So we've had young people come in and ask for the vaccinations, and we've had couples here. So it's been a really great incentive, and we've been quite fortunate enough to be a part of that partnership with Riverland.
We were approached by ac.care as to what we may be able to do to support their vulnerable clients. Yes. And the decision was made that to actually support them in the healthcare field specific to immunisations would be of benefit, with also the expected very bad flu season.
Health is one of the biggest priorities in our service. So our most vulnerable clients are the ones that have been sleeping rough, sometimes they're quite chronically unwell. So if they've got other ailments that go along with it, obviously the flu season is quite bad to get it because they've probably got something underlying as well, like chronic lung conditions. Some of them might have some heart, and they might be elderly and frail as well. So if they're not accessing potentially health services to address their health, at least they're not going to get the flu. If they're immunised from the flu, that's one thing they don't need to worry about. There's no cost for it.
Within the discussions with ac.care, it became evident that at times some of their clients find it difficult or very reluctant to access the healthcare systems that are provided locally. So by the provision or developing this sponsorship program or initiative with ac.care, it meant with support their clients were able to be offered the opportunity for immunisation, and whether they decided to actually take that up with encouragement by their care workers and support workers, then at least the opportunity was there for them. This isn't our first collaboration with ac.care. We've previously provided healthcare checks for their vulnerable clients. This is done to support them in ensuring that at least once a year they are provided with thorough checks to ensure that they are healthy, and if not, to provide care or to be referred to appropriate other services within the Riverland.
We've been very grateful for that because we have potentially saved lives for a couple of our clients who were quite unwell on the riverbank, and they've actually consequently have gone into housing because of their health was so poor. But now it's been addressed.
When we have the opportunity to be involved in an initiative such as this, we'd certainly we take it on board, and we'd also appreciate the fact that organisations such as ac.care do seek our assistance.
Community partnership is really important because having that collaboration and getting the word out there to our partners, and talking to about what our clients' needs are, accessing health, accessing education and job networks, it is really important because without addressing any of those needs, it's really hard for clients to live and be stable in their house.